This talk is about the key challenges and best practices for autism spectrum disorder, popularly known as autism. The speaker, we have Professor Satya Mahapatra, the founder and director of Institute of Health Sciences, Odisha, and the chief coordinator of the Eastern Zone at Rehabilitation Council of India. Our speaker, Professor Satya Mahapatra, he has been a practicing clinician treating thousands of disabled persons across the country, having worked for governments of Gujarat, Madhya Pradesh, Odisha, and connected with more civil society organizations informally. He is the founder of the Institute of Health Sciences, the only autonomous college in India for manpower development in rehabilitation sciences like physiotherapy, audiology, and speech-language pathology, special education and rehabilitation sciences, and allied health sciences like physiotherapy, occupational therapy, etc. He is renowned for introducing the professional audio vestibular medicine in India. We are very happy to have you here, sir. Over to you.
Namaskar, DiversAsia, and the organizers of this wonderful event, all the people who are present here to deliberate on issues that affect the most vulnerable people in the society. As they say, the chain is as strong as its weakest link. When you don't have enough resources, enough persons, or the suitable ecosystem for the most vulnerable people, well, it's a pitiable condition. We have plenty of grievances, plenty of issues to address, and where we stand, we are optimistic that some good thing have begun and perhaps will go far in handling issues of concern and maybe sort them out. I'm supposed to talk about autism, and do I know enough or do I know everything about autism? Sorry, I think I am a student of autism. When we coined the term of autism, there were many alternatives, and now we have settled down on the word autism or autism spectrum disorder. When I was a student in the 70s in the All India Institute of Speech and Hearing, Mysore University, my professor recommended a phrase, minimal brain dysfunction. I said, sir, what is it? Minimal brain dysfunction? He said, well, honestly, we don't know. This person or this child doesn't have intellectual disability, but behaves funny, not having speech or social communication, but he has all the intelligence normal, yet not speaking. Well, so we are talking about autism. Honestly, we are not able to figure out what the hell is happening. So, instead of understanding the issue in toto, we look at components and boast about our ability to make a difference in that particular domain. So, a group of professionals with the specializations in communication or behavioral science or sensory issues or motor issues, they tend to talk about autism as if only that particular issue matters. A speech therapist would talk about the communication, the psychologist would talk about the behavioral issues, the occupational therapist would talk about the sensory overloads or sensory integration issues. A special educator will talk about the child's ability or inability to learn and to be suitable in a education setup. But do anyone claim that they can take care of the needs of the child with autism completely, holistically? No. So there are many a slip between the cup and the lip. Changing statistics, that's what I have mentioned here, because sometime it was 1 in 30,000 live births. One child became autism affected. 1 in 30,000, and the recent figure, what I was reading in an article, was 1 in 30. Over the 50 years, there is a alarming rise in incidences of autism affected children, and that is not restricted to any particular city, state, country. It's a global phenomena. The rise in incidence of autism should have alarmed us long back, but yet, even now, we are still debating and waiting for the child to develop all the features of autism to respond. So the wildfire in the jungle, when it starts, should you respond when the smell or the smoke is evident, or only after it's all destroyed? Well, many people who are actually concerned about their children or child's peculiar behavior or ability or inability to use normal communication, when they go to doctors, doctors often tell, oh, it's too early. Don't worry, wait. The child may overcome. What the doctor is actually telling is his inability to understand how to diagnose autism or how to handle autism. The child suffers for a lifetime due to the incompetency or ignorance of the person who is supposed to know everything about the child's disorders. Now, when we go to a professional for assessment, what do? They, like any other layman, look at the manifested behavior. And the manifested behavior, you kind of evaluate using a checklist and quantify, give a score. This is the severity or this is the percentage. Is it really true that the manifested symptoms are the only issues of concern? Well, their functional skills, whether the child is having speech suitable for his age, the social behavior. When you study all that, study the developmental history, the milestones of motor skills or communication skills, all that. It is just a relative or the comparison with the norm, and you say, okay, this child is delayed in the development. So a developmental disorder, that's the branding, that's the labeling, that's the term you stick on the child without understanding properly what all things to assess. The assessment remains superficial and incomplete. unfortunately. Well, here is a diversity. We have a word diversity with a very positive intention for acceptance of people who have been suffering from all this kind of challenges. But here is a diversity that is a very big challenge. Children with autism, for them, a particular norm or normative do not apply. That is, suppose Pati sir said about intellectual disability, okay, you know, this is the IQ level below which you level it, level the child as a person with intellectual disability. What about a child with autism? The child with autism may have above average intelligence, may have just normal intelligence, may have subnormal intelligence, may have no communication skill, completely non-verbal, may have minimal need-based communication skill, may have the ability to speak like anybody, may have just some pragmatic issues, nothing much, yet in the autism spectrum, they have a variety of comorbidities. People with autism, when we evaluate, quite a large segment of them have subclinical epileptic seizures. Quite a lot of them have dysbiosis, gut issues. Should we just look at the manifested symptoms like, okay, the child is having a fidgety or restlessness or stimming or limited interest in activities, only those things, or more underlying issues of leaky gut? Then the case history, when we talk about the case history, okay, we talk about the prenatal or birth history or the early child development. Many people come with diverse case histories. Some do have issues before the birth, or have issues during the birth, have issues after the birth. Some have a lot of infections or illness in the early childhood. Some children have absolutely nothing, perfect health, yet developing autism. Some have issues of regression. The child starts normally, has normal motor milestones, started speaking few words, few phrases, and then regressed into kind of self-possessed or solitary play, or regressing into his own world. So you don't know whom to level. Then suppose we look at 100 children with autism. Do they fit into a particular picture? No. There is so much of variation, so much of differences, that we are bound to use a word spectrum. Autism spectrum disorder. So it is not just autism, it's a autism spectrum disorder. So people who are labeled as autism affected may have varied kind of symptoms, or in different compositions, different severity, yet are autism. Now, if there is no universality, is there a consistency? Consistency means, suppose you are labeling somebody with a deafness, is born with say 80 decibel loss. Today you assess 80 decibel loss, after 5 days, 5 months, 5 years, that 80 decibel loss will be there. Okay? But in autism, no. Today, the child is having toe walking, jumping around. Tomorrow, that toe walking may not be evident at all. The child may be today crying, having meltdown today, and maybe after some time the child is not showing that symptoms. So there is no consistency of the behavior, no universality. How do you diagnose autism? Well, you can diagnose a person with, say, hypertension. You know, what is the normal range? Normal range for blood pressure. Okay, if the person is not fitting into the normal range, so you say, okay, he is hypertensive. Or maybe the blood sugar level you measure and say, okay, this person is diabetic. But there is no such biomarker. As we look at only behavioral symptoms, because it's visible, we think that is the only thing, and we limit our interest to only visible or manifested symptoms and put a level of autism. But the underlying issues, I don't know whether there is cause-effect relationship, but there is plenty of underlying issues, comorbidities. Unless we have a agreement on linking the comorbidity with the autism or certain particular biomarker with autism, our diagnosis will continue to be with some kind of question mark and will be actually nervous in putting the level of autism. So that's the reason why many people delay the leveling of autism until much harm has been done or maybe irreversible damage has already been done, unfortunately. So because there is so much of fluctuation and regression and many kind of systemic malfunctions, that is entire endocrine system is not in normal state. So what do you do? Your diagnosis itself is under scanner, or your ability to diagnose autism is to be challenged. I have used a very bad picture over here. I feel sad and very emotional. How do we deal with children who are suffering and suffering for lifetime disability just because of my ignorance, my incompetency, my fear of making a mistake, and they get into the club of autism where nobody knows for sure what to do. Right now we are talking about special education. Can a special educator deal with autism? A big question mark. An autism affected child who is not even attending a school can look at a board on the side and read it. Can look at the newspaper and just read it, who hasn't been taught. That means a person who is not able to use appropriate communication, socially appropriate communication, is able to read a paper, maybe he doesn't understand anything at all. So the special educator has to grow up to understand the actual ability and disability of children with autism. The speech therapist has to grow up to understand how to handle a child's communication disorder who is having autism. So the so-called integration of children in a normal school is not easy at all. They will be the disruptive elements in the school. Normal school cannot cope with the children with autism unless they are properly sensitized, trained, and equipped with the suitable ecosystem where a child with autism can be handled. We can make a policy. We can enforce the normal schools to enroll the students. You can have a right-based act. But the practicality is a child with autism has unique needs, and that requires professionals like us to grow up and find solutions for them. The family and the social space, that is the most pitiable condition. Parents quit the job just to handle the child with autism. They also go through the trauma of handling a child with autism, including going for the divorces and suicides. I'm handling hundreds of cases with autism, and the parents and the family, their pain, their agony, their frustration is kind of hell. And why they are suffering is because we professionals, we are still not sure. We are not unanimous in even assessment or diagnosis or the treatment or management or the rehabilitation, anything. Yet, we have to do something. We have to work on the functional independence. A child with autism has to acquire the communication skills, the social skills, the reading, writing skills, has to be part of the mainstream society. As professionals, we have to work towards their functional skill development. The support system integration is required. That is, we have a health department, we have a education department, we have the disability department, we have the transport department. Unless they all come together, they sync in their efforts for the person with the disability like autism. It is too tough a challenge. There will be disintegration only. I said training the stakeholders means even the parents needs training, how to handle a child with autism. The school teachers need training. There are many different groups. Our training programs, capsules, have to be developed so the child with autism can have a near normal life. Professionals who are required to deal with autism, we know many functional therapies like speech therapy, psychotherapy, occupational therapy, special education, all that. In most cases, most of these professionals are in short supply. And when there is short supply, what happens is the quality of services definitely are compromised, even if you reach a professional. Like I was visiting a Government of India institution in Odisha, where one speech therapist is on a daily basis attending something like 140, 150 cases. 140, 150 cases of speech cases by one person. Is it ever possible? What are you doing? Just a bit of paperwork, not truly services. So most of these training institutions are not adequately supported, like Patisar said. So their infrastructure and their capacity, all that needs to be augmented by support from the local, from the global, fraternity and community. We have to join hands. Well, if we look at a child with autism, at the Institute of Health Sciences, those who come during the early intervention phase, most of them are discharged with age-appropriate functional skills in all the verticals. They drop all the features of autism, they become completely normal. They are suitable to be part of the normal mainstream schools and mainstream society without any need for further support. But if you delay in diagnosis, delay in referral, delay in the intervention, the critical age we agree to be 6 years. When the child comes for intervention after 6 years, you don't talk about dropping the diagnosis. You don't talk about dropping the features. You just talk about the management, and that management is for lifetime. What? How can you manage a person for lifetime? How much resources you have to mobilize? And when the child comes during the early intervention phase of 0 to 3, it's very easy to handle the child. When he grows up into his 20s, 30s, 40s, how do you handle such a person with autism who has unruly behavior? He can be, I've seen some of the missed opportunity cases, looking like wild animal. How to handle? Parents are heartbroken. They don't know what to do. They lock up the child, person with autism, when they grow up. If we miss the bus of early intervention, we are committing the crime of leveling someone disabled for lifetime. Unless we come together, this suffering is not going to be limited to few people. It's going to be truly a wildfire affecting any and everybody. That is, if in 50 years, 1 in 30,000 has become 1 in 30, you don't know what the future is. So here my questions, this is not my answers. My questions is, should we talk about neurodiversity and talk about the acceptance, or talk about the different ability and evolve ourselves to cater to their needs? Should we talk about special needs or special ecosystem? Is it their need or our inability? What we should talk about? If we talk about their needs, we can clean our hands of, okay, some needs have been met. No, it is our level of understanding, our level of resources, our level of that ecosystem needs to grow up, improve. My question again is medical management. There is a lot of differences in opinion. They consider autism to be neurodiverse and has to be accepted. But what do you do when a child is having all these medical conditions of epileptic seizures, the gut issues? The meltdown is not a behavioral issue. I am talking about, it's a neurophysiological phenomena. Are we going to shut our eyes to the medical aspect? The rehabilitation professionals, the medical professionals, the education, the other system should all come together to understand what is happening and find a complete solution, the total, holistic, not just talk about the part and glorify. So the holistic care versus symptom management. If you are talking of just the manifested features of behavior or sensory overloads or communication, symptom management. You have fever and you take paracetamol. without diagnosis, whether it's malaria, tuberculosis, typhoid, and just be quiet, your fever is managed for a short period? Or should we go for proper diagnosis? Many parents, when they come to me, sir, what happened to our child? Did we do some mistakes that our child became autism affected? Did we neglect in the upbringing of the child, or do we have something genetic defect that caused autism? Sorry, I say I have no answer to that. What causes autism? I don't know. If I don't know even what causes autism, how do we prevent? How do you protect the future generation from getting affected? So, who we are? We are ignorant on every parameter. We are incompetent in every parameter. And we call ourselves experts. So, when it is institutional care, we cannot prevent perhaps autism as things stand now, but prevent disability, lifetime disability. The functional skills, as far as possible, should be augmented. They should be part of the social mainstream, so integration of the social system. Multimodal therapy, that is a team of professional experts should come together, not just talk about their own importance. Unless they come together, the child should be the center, not the professionals. Then things might happen. The professional should try to fit into the needs of the child, not the child should try to fit into the professional's expertise and education. And the optimal doses of therapy. Just now, when I quoted example, one person having so much of cases, this overload prevents proper therapy, appropriate doses. What we found, something like weekly, about 20 hours of multimodal therapy is essential. Less than that, it's not working. So that much number of professionals are required to handle the needs of the people with autism. So optimal doses, again, we need to further do research and find out what is the optimal doses. Internationally, we should have such unanimity in our approach. And the integrative approach coming together, holistic, integrative. The biomedical intervention, there is plenty of discussion. Oh. There are plenty of discussion about the biomedical interventions for the autism, and there is differences. We professionals, we argue, we should do this, we shouldn't do that, whether other people talking of different things that doesn't fit into the mainstream perception or mainstream peddling of ideas, we shut them up. So what should we do, the biomedical intervention or not? These are the questions I have been asking, and I hope we work towards the suitable answer for the children with autism.
Thank you so much, Professor Mahapatra, for sharing your very valuable experience of serving the students with autism. And as he rightly pointed out,